This is a high yield step 2 OBGYN question, so if you want some extra marks on exam day, stick around for the explanation. A 28-year-old woman, G2P1, at 34 weeks gestation, comes to the emergency department with vaginal bleeding for the past 2 hours. She reports that the bleeding is painless and began suddenly after she got home from work. She denies contractions or abdominal pain. Her prenatal course has been uncomplicated. Vital signs are stable and her fetal heart monitoring is reassuring. On exam, the uterus is non-tender and appropriate for gestational age. Which of the following is the most appropriate next step in management? Now let's establish the diagnosis using the hints in the vignette. So she's at 34 weeks gestation, that's third trimester. She has vaginal bleeding that's painless, and her vital signs are normal, but the fetus's vital signs are also normal as well. Now what are we thinking? We want to be thinking placenta previa. Placenta previa is third trimester vaginal bleeding that has no effect on the fetus's heart rate, no bradycardia, no tachycardia. Therefore, we're thinking placenta previa. Now let's start with A, perform digital vaginal examination to assess cervical dilation. This is a complete contraindication to placenta previa because doing a digital vaginal examination may injure the placenta that's immediately apparent at the cervix. You don't want to do anything until you're sure what you're dealing with. We haven't really done any imaging to assess if it's placenta previa, so therefore a digital vaginal examination is premature and can also be contraindicated if we confirm that it is placenta previa. Now moving on to B, administer corticosteroids for fetal lung maturity. Usually this is what we do when we have a preterm labor. We prepare the fetus to be born by giving them corticosteroids early for fetal lung maturity. However, in this vignette, we still don't know what's going on. They haven't done any testing to ensure what's going on. We don't know if there's going to be any preterm labor. Therefore, B is premature. We need to know what's going on first before we assess and before we diagnose and treat with corticosteroids for fetal lung maturity and the possibility that we might have a preterm labor. Now for C, immediate cesarean delivery or C-section. Usually C-sections are done when you can't have a vaginal delivery or in case of an emergency. In this situation here, the patient's vitals are stable and the fetal heart rate monitoring is reassuring. So both the patient and the fetus are safe right now. They're not in any danger. So a C-section would be premature. And as I said before, we really need to confirm the diagnosis before we take the next plan of action. And option D, order a transabdominal ultrasound. This is the correct answer. This is our next best step in this situation. We want to confirm that placenta previa is indeed happening for us to make a plan of what we're going to do next. Doing anything else would be premature. As I said before, if we did like what it suggests in A, a digital vaginal examination, we'd cause hemorrhage because there's a placenta previa occurring. So therefore, D is the correct answer. We need to image, confirm that we have placenta previa, and then from there we make the next best plan of action. Last but not least, E, tocolysis with indomethacin. We give tocolytics in preterm labor, so the vignette would have to say she's having contractions at 34 weeks gestation. However, there's no indication that she's having preterm labor. We would do this to delay birth by a couple days so that we can prepare the fetus for birth and early delivery by giving corticosteroids, magnesium, and other things as well. However, there's no indication in this question that she's going into preterm labor, and our main concern is the bleeding happening from placenta previa. Therefore, E is not the correct answer. This concludes the video. Thank you so much for watching. If you enjoyed this video, please follow our page on Instagram, follow our TikTok and YouTube. Thank you for watching.